obvious beauty many other African countries exude, but beauty can be found in its people. This beauty is often masked in hardship. 65% of people here live on $1 a day. Many survive solely on what they're able to grow. Malnutrition, poor sanitation, and diseases like malaria plague the population, and children are especially susceptible. 12.5% of children born die at birth, and 21% do not live to see age 5. Chad is not for the faint of heart, but after their first visit, physicians Olin and Danae Netteberg felt it was exactly where God wanted them to be.
We actually told the church we requested this place. We requested to come here to bury Chad. We saw a huge need, especially in as it pertains to women's health. My wife is a gynecologist, so we felt that it was really where we were most needed, and we felt a true calling here. So we asked the church to send us here, and less than a year later, here we were.
Olin and Danae serve at the Barry Adventist Hospital in southwestern Chad. This medical institution has been in operation since the 1960s. Set on a quiet, dusty road, from the outside it bears little resemblance to what you might consider a major medical facility. But in 1980, the health center became a hospital, and today it operates as the district hospital and is the only hospital in a district of 200,000 people. On the campus, you'll find no shortage of action. Not only are all the beds generally full, but the courtyard serves as a home away from home for family members of patients who are on site to help care for their relatives. A constant stream of surgical patients keeps the operating room busy, and the occasional cry of a newborn cuts through the bustle. The Barry Hospital fills a major need for medical care in this area of the country, but its facilities leave much to be desired.
Our facilities here are pretty subpar, even by Chadian standards. When the government people come through to evaluate our hospital, there's always two glowing needs that we have here. One is our maternity ward is fairly atrocious. The other one is our surgical suite is not really made to be very effective or very clean, very sterile. And then as our patient population grows, we just simply run out of space. And as soon as patients are good enough, we kick them out to the veranda. As soon as we figure that they're good enough to go into the mango trees, we kick them out into the mango trees. And we're still lacking space, even using the mango trees, even using the veranda. We often have a waiting list of 7, 8, 9 people who are waiting for surgery that we can't operate on simply because we don't have a place to put them. We've actually had patients report to us that they refuse to come to our hospital because we don't have adequate facilities. And yeah, that's patients that we can't treat, but it's also human beings that we can't minister to as a church and as children of God.
In addition to the subpar facilities, the hospital also lacks housing for staff and volunteers. The hospital depends on committed long-term missionaries like Olin and Danae, as well as volunteers who serve for shorter periods of time. But recruiting the necessary staff is difficult when the hospital is unable to provide safe housing. The Barry staff were looking for a solution that could solve some of these issues, and after researching several options, they felt that one-day structures could be a good fit. They consulted with ASI member Garland and Nealis for help in designing structures that would work for the hospital. Constructing the buildings would require a team of intrepid workers. 14 Maranatha volunteers from the United States, Canada, and Korea landed in Chad to help fulfill the hospital's dream of better facilities. But they didn't fully appreciate the impact their work would have until they toured the hospital.
The beds were all full, people sitting around inside. You have to see it to believe it. It's just it's amazing how bad it is.
I will never complain about hospitals when I go back home. It was just, I couldn't quit shaking my head when I walked around. The wards were so dark you could not even see the people in there. I don't even know how they could see to operate. The things that we take so much for granted, they don't even have what we think are the basic things.
Motivated by what they saw, the volunteers worked harder and buildings began to rise out of the ground at record speed.
We have been flooded with Maranatha volunteers who are coming out, they're sweating in the sun, they're not uttering an ounce of complaint, they're setting such a pace that people here just couldn't possibly have imagined things going up this quickly before they saw it with their own eyes.
The new buildings include a spacious operating room, maternity ward, and 2 private wards. Volunteers also constructed several houses for both short-term volunteers and missionaries, so they will have a safe place to live on the hospital campus. Aside from the buildings, volunteers worked on another important component of the project, new hospital beds. More than 100 beds were assembled and will provide comfort to the patients.
And every bed that I put together, I think, you know, there's going to be somebody that'll be laying on that bed, and they will be getting the treatment that they need to help them to have better health. So it's a small part, it's a big part actually of the whole place.
Although the volunteers' main project was contained within the walls of the hospital, they turned the commute to and from the job site into an opportunity to interact with the community.
Well, the trip to and from is just an awesome experience, because as we drive along, we're sitting in the back of this little pickup, a bunch of us, and it's kind of like being in a parade. We're waving at all the kids, and they're laughing and waving back and speaking to us, and it's been a real lot of fun.
Even the adults have warmed up and they are waving and smiling, and it seems like they've been very open to us being here, and they know what's happening in with this facility, and so I think it's been a really a good interaction with the community, just being here, being able to mingle with the people, and helping them, and I think they know that we're here to help them to have a good hospital where that they can go if they're sick.
The work the volunteers did will impact the lives of thousands of people in Chad, but the experience impacted them as well.
I don't know, it's so easy in North America to get whatever you need, right? It's whenever you want something, you need something, you just go and buy it. Whereas I feel like when we're here, the only thing you can do is pray for a miracle. And when that happens, it's just such a big faith builder for me.
This first project is the beginning of a new start for the Barrie Hospital.
What just makes it that more of a shining example of a church that's out serving God from the medical standpoint as well as from the evangelistic standpoint. So it opens up a lot of doors, it opens up a lot of peoples who we wouldn't otherwise be able to witness to.